Recovery Reform is a podcast that provides educational content while addressing the stigma against drugs and the people who use them. Expertise meets lived experience as the hosts and their respective guests unpack the multifaceted cause that is recovery reform.
Welcome back to Recovery Reform. This is Dr. Nichols here with my co-host, as always, McCauley Sexton. We are going to talk about ketamine. McCauley, how are you doing?
Doing good. How are you?
Good. What are your when I say ketamine, what are your thoughts? What is your immediate reaction?
My immediate reaction is I think of the term K-home instead of K-hole. I think of a lot of trippy stuff because I've experienced it only in a medical setting. Never did it, recreationally or via the illicit supply. And so my take on it is honestly very privileged because of that. But yeah, I think about my experience. I also think about the stigma.
Absolutely. Well, it is it's definitely a controversial topic to bring up in discussions about substance use and in harm reduction spaces. But I will say, my board certification, my background training is in emergency medicine, and I still work in the emergency department. We use ketamine all the time. It is not a new drug. It is very safe when used sort of in a measured manner in the appropriate context. And we use it a lot for sedation or for pain. It has a lot of uses. It has some anti-seizure activity, so now can be used in the context of like intractable seizures, essentially. If somebody comes in what we call status epilepticus, it can help in the management of seizures. So yeah, there are a lot of uses. It's a very interesting drug. I'm kind of fascinated by it. But I am interested to hear your thoughts and also like your personal experience, since you've done it in a medically controlled setting. What was the experience of having received ketamine in that setting?
Well, first of all, I have to kind of acknowledge that the stigma that I had kind of internalized as it relates to medications was so strong that initially when someone suggested it, I was like, no, absolutely not. And mind you, this was like 7 years ago, but it was my mom who said, hey, you should look into this, and I was, 4 or 5 years into my so-called recovery process. And I was in like a real mental health crisis because I had kind of left 12-step and I was kind of trying to figure out what to do, and I had all that kind of indoctrination swirling around in my brain. So I just didn't really know what to do, but I was strongly against returning to any pharmaceutical or returning to any form of use. It was just like, that's not on the table. And that was actually dangerous because it kind of made me go a little bit darker.
Yeah. Well, and to be clear, ketamine is a controlled substance, a Schedule III controlled substance. So in that stigma about pharmaceuticals, and particularly, I imagine, controlled substances factored heavily into that, it is a controlled substance. And there is, there is a ketamine use disorder that is defined, and so it can develop sort of compulsive use in an addictive way, but less so than other substances. And that was you had never used it recreationally previously. That was not an issue for you. But you had internalized that stigma so much so that kind of impacted your view of ketamine as well.
Yeah. I knew that my uncle, or my great uncle rather, was someone who used ketamine regularly. And so I guess that tied with this idea that because I was related to that individual, that somehow it would inflame a compulsion was like really strong. And I also didn't understand what ketamine did. So it was part of it was just being uneducated and not really aware of the effects of ketamine, because I can tell you after receiving an infusion, it's not something that I want to do. Like I've had 2 infusions and I don't really want to do another one. I don't know. I'm willing to if I got to a place to where my OCD came back really strong or something. Then yes, I would like entertain that. But it's let's not kind of get it twisted here. It's not fully easy. There's some work to it if you're going in and unpacking these traumas and working on these mental health things. So
And
just
so
to
you're saying that the ketamine helped you with that, and that was
oh yeah
you used it in sort of a guided way
yeah. So
to unpack trauma and to work on underlying issues. You mentioned if your OCD came back, that would be something you would think.
yeah,
Um,
and to be clear, if it came back like stronger, it's there already. It's still there, but it's been reduced drastically since I received the second infusion. And to actually like answer your initial question, I can tell you like the experience of getting the infusion briefly. I won't go like too deep into that, but I do like third party non-medical caretaking for a place out in Vegas that provides this, and so I was able to witness this first. So that's part of this, is that I'm someone who likes to really investigate things. So not only did I read a lot, but I also like saw this many, many, many times prior to being open to doing this. And what I saw, again, from like an anecdotal place, but from a very human place, was people who were having really significant spiritual experiences, which like people know about me. I really steer clear of the whole like idea of a spiritual experience being necessary or required when it comes to recovery or whatever you want to call it. And so it wasn't so much about that. It was just like that validated it for me. It wasn't like, oh, I need to have a spiritual experience. It was like, oh, this is like really cool to see people have these like really beautiful experiences with this. And because again, the stigma tied to like a pharmaceutical, I was like, there's no way that like a pharmaceutical is going to give you this really profound experience. It doesn't make sense to me because it's not from a plant. And so I had this kind of like elitist, kind of naturalist view of like substances that you'll find, like this hierarchy of like pharmaceutical bad, plant medicine good. And it's just so not true. So I had to kind of unpack that, and then that made me willing to try it. And prior to the infusion, I was scared. I was thinking of reasons not to do it. The OCD was like kicking in really, really strong, and then like just this kind of this real kind of wild thing where I was going into potentials that are not even like acknowledged really, or like I was just like, oh, I'm gonna go into like a lifelong psychosis if I do this, or I'm gonna go into like a permanent disassociative state. Like I was going in all these directions, and so I was like, it's almost like I was trying to talk myself out of it, you know. You
well, I'm
know?
sure that fear was there, and so you wanted to find sort of reasons, and there's plenty of reasons to be afraid. Like,
Yeah,
right, people are afraid of anesthesia. It's used as an anesthetic,
yeah,
um, and we use it for sedation. It can make you fully dissociated. Um, so there are plenty of reasons, understandably, to be afraid. I mean, and we had mentioned this um, previously, but examples like Matthew Perry are in the public sphere, where Matthew Perry died, drowning in a hot tub with um, ketamine in his system. So there are plenty of reasons to be afraid um, about the idea of using ketamine. You were in a safe, controlled environment, and this is not the same as sort of Matthew Perry's situation. Um, you were in a safe, monitored, observed space, and so obviously I would recommend that if you are going to use ketamine, to do it safely in that kind of setting, in a controlled environment and with people who are trained know what they're doing and can monitor you and make sure that you're safe. And you are in that context, and certainly, as you acknowledge, that is a place of privilege. Um, but when you're in that space and you work your way through all these fears, and the OCD is kicking in, and then you decided to go forward with doing the infusion, and it sounds like you found that beneficial.
Yeah. Yeah. I mean, it's also relevant to acknowledge that when I got there, I was like, "Hey, doc, can you like give me less than you anticipated?" And he was like, "Hey, dude, I already put it in the bag. Like, he's like, you paid for it already." And also, I want to acknowledge that this was being administered by an anesthesiologist. So ideally, that is who you want administering ketamine. Someone who is very skilled and also putting in uh, an IV, which really reduces a lot of the fear and anxiety around this when someone is an expert at putting in an IV, which is something that, again, if you go to some of these clinics, they have someone who may be a little bit less qualified and will like miss and like is really struggling to get an IV in. Whereas like, this doctor gets an IV in your hand like in seconds. So I just had to give him some credit for that because it definitely reduced a lot of anxiety around it. Just the ability to quickly put an IV in.
And that's a
And
difficult skill, and I will say, yeah, I would give nurses credit here that they put in
yes,
more IVs than most physicians, and they're probably the best trained people, other than anesthesiologists who put in a lot of IVs. As an emergency department physician, I don't. The nurses do. I'll put
yeah,
them in occasionally when we use ultrasound guidance or whatever. We need to establish a really difficult line, but I don't do as many. So yeah, an anesthesiologist might be the best person in terms of putting in an IV or a nurse, but definitely, not just putting in the IV, but having somebody trained and knowing what they're doing in terms of the infusion is
yeah. And I agree with your sentiment in regards to nurses as well. I think the thing is when it comes to these clinics, technically there are going to be clinics out there to where it is not a medical professional that is putting an IV in. And so people just need to become aware of that because it's scary when someone misses and then actually can like administers the IV and then you have like a literal like bubble in your. I've had that happen in like an IV hydration clinic, so that's where that's coming
okay.
from. So just
Okay.
to be clear,
Okay.
but let me actually answer your question because I keep going off in these different areas. But so the experience was, immediately gave me kind of like a initial test dose into the line. So that was like, just to see if there's any sort of adverse reaction or anything like that, which I think is also was comforting. It's like, okay, they're not just hooking me up. And yeah, it was really mild when they gave me that small dose, and they were like, "You're good to go." And it was very quick. The effects were very, very, very quick. Like overwhelmingly quick to the point where it was like 0 to a million in what felt like seconds. It was probably more like, I want to say a minute or maybe a little bit more, but it was just very strong. And the thing is that because I have experience with psychedelics, I just was like, just surrender to this process, just let go, don't fight it. And so I didn't fight it at all, and it was surprising that I didn't because it's kind of like this subconscious thing that when something that's that overwhelming, you want to kind of try to control it. And just in kind of in a more clear and concise summary, I can just say that it made me think about how much my personal relationships mattered. It validated who I am as a person. It was very encouraging. It had an energy of being supportive and an acknowledgement of the effort that I put into life and the just the meaning to things. And it definitely it helped me with OCD so much so that it reduced drastically after one infusion. Um, and it kind of helped me to look at some things when it came to like fears as it relates to flying, because I had to fly home, and it was like kind of giving me these messages. And I always say, like, not like I'm having auditory hallucinations. It's kind of like you're getting these messages that you're interpreting. And it was like, you're not going to die on a plane, so stop worrying about that. You're going to live to be an old man, so stop worrying about any other thing like that. You're going to live a long life. It showed me a timeline, and it was like, you're born, you die, you're old when you die. And so, yeah, it laid out a lot of really trippy stuff, but it was encouraging, supportive, validating, and spiritual. It was very, very spiritual. So, I mean, that's really what it was.
It sounds like you kind of saw the, like, you're saying it went 0 to 60. I see it. What I hear in my head is like a rocket ship taking off, and you kind of saw the universe.
Yeah.
You like,
Yeah.
you kind of like got some perspective
Yeah.
from that, and that was like that was an overall positive. And I think, I mean, so, and there is data to support this. The S-ketamine, when in one enantiomer of ketamine, is FDA approved as a nasal spray for the treatment of treatment-resistant depression,
Yeah.
in multiple doses, sort of over a specified frequency. And you don't have to do all of them, but it's sort of multiple times. And that has shown benefit for treating depression. And sounds, I actually hadn't heard of people using it in terms of OCD and it helping. That's actually really interesting. It makes sense based on that data in terms of supporting the use for treatment-resistant depression, that it could help with other mental health issues. And one of those that is frequently discussed and the data is mixed is for the treatment of substance use. Right, and that's why we're talking about it. And it's interesting because so you've seen a lot of these,
Mhm.
doing non-medical caretaking, and I've seen a lot of ketamine used in even higher doses for sedation, anesthesia, um, in the emergency department anesthesia setting, and it's right, it's safe. In fact, one of the first papers that noticed that patients who were depressed, so was especially used, was discovered back in the 50s, used in anesthesia, still is used in anesthesia, but was used even more frequently back then without as many other um, medications that can be used as we use now. And the first paper was in 1975 that discussed the decrease in depression of patients who had undergone anesthesia with ketamine, which is interesting. I think that's sort of fascinating that long ago this was already sort of discovered or seen that it had that effect. And these are in high doses, right, used to completely dissociate people for anesthesia. And in the emergency department, we use it all the time. We see that it's safe. We use it in high doses. The issues that people can face in terms of safety are that it can cause what we call laryngospasm, where your vocal cords, your larynx can spasm up, and that can make it so you can't get air exchange. And so when you're in a medically supervised setting, we can use like what we call a bag valve mask. You'll see, like, people will think of like an EMT or something,
Yeah.
where you breathe, and if you use enough force, usually in terms of breathing for somebody, you're pushing air in that's getting oxygen in, and often it breaks the spasm. And then some people can have a bad, what we call emergence reaction, whereas they come out of um, that sort of dissociated state, that they can get aggressive, or have a bad experience, bad reaction. Those are usually the two biggest things we worry about from the medical standpoint. Now, obviously, from the patient side, depending on what their experience is, you had a very positive experience. And I know not everybody has the same experience, and some people have reason to worry. Maybe it's going to, just so you have some psychedelic experience. Maybe people who haven't had that same experience might make them feel more anxious or afraid. And so all things to consider and be prepared for. But in terms of if that was something that you were to pursue, but I know that this is a discussion that people are having within harm reduction, substance use spaces, who are considering using ketamine treatments. So I think it's important that we talk about it. I think it's important that people are aware and are aware of both the data to support its use, and also there's data that suggests that it may not be helpful from the patient perspective, whether or not you are going to have a positive experience or what might happen, and then what the risks are. And in terms of the risks, they're often, like I said with Matthew Perry, like the risks are often conveyed in a way where this is like you're gonna die if you use ketamine once or get a ketamine, and
Yeah.
that's just not the case. Um, you're talking about a situation that was pretty extreme. Someone who was using in a non-medical setting in a non-medical way, whereas McCauley, what you're talking about is like in a supervised medical setting with a very specified dose, and you ended up having and two times, and you ended up having a very positive experience in a way that like you felt was provided some resolution. It sounds like
Yeah.
you feel like I don't need to go back and do it,
Yeah.
at least
And
for now.
the normal protocol for depression is like 6 infusions. And I want to be clear. My first infusion, it had BRNAD plus in it. And so that's why I was able to get it for OCD, with the intention of getting it for OCD. In that setting, they're very by the book. When it came to my second infusion, my clinician suggested that I do just ketamine. And so I had documented depression, because I actually went into a bout of like very deep depression and grief and loss because I lost a loved one. And so that was the motivation to do the second one. And so I bring that up so people can do their research and talk to their clinician about it. And my clinician was supportive of it. And guess what? Also does ketamine integration therapy. And so after my first infusion, I did ketamine integration therapy. After my second, I did it as well. And that's why it solidified a lot of the work, is because I went into it very intentionally. And the first time, to be honest, my intentions kind of went out the window because of how kind of strong it was. And it kind of guided me. It gave me this idea of how it worked. It was like, again, kind of like put its arm around me. It was like, hey, this is how this works. Focus on one thing, resolve it, and move on to the next. And yeah, my experience was good because of the foundation of work, if you want to call it, that I had already established when it came to my mental health. And so I didn't have things that were hidden or dormant. And so people do have to be aware that like it almost has this like truth serum aspect for some people. And so when there are things that need to be talked about or addressed, it can often like bring them up. And so again, like because of the privilege I had having access to a lot of different clinical stuff prior, it was just a different experience. And because I've experienced a lot of psychedelics, that's why I had a good experience with it. I want to be very, very clear. And out of the 30 plus infusions that I've seen, and sat with people and helped them to set their intentions and all of that, I've had one person who was like, it made me think about some stuff I didn't want to think about. And so that is very possible that it will make you think about things that maybe you don't want to. And so people need to be aware of that, And the other thing I wanted to kind of go into a little bit, because you've mentioned Matthew Perry a couple times, is my perspective on that thing is that you just see the media and you see our culture as a whole just like infantilizing him, and at the same time not understanding that the reason that this happened was because of the way he was engaging in ketamine. Like 100%, that's what's going on here. And instead of being like, okay, like this individual took it upon themselves to take what I'm assuming, pretty sure it was intramuscular ketamine at home in a hot tub while also on buprenorphine, while also, I don't know, on other medications. You can pass out in a hot tub without any of those medications in your system. That's why they say don't stay in a hot tub for more than 30 minutes or whatever. So it's interesting how they kind of hyper focused on ketamine. And yes, we can acknowledge that, like, obviously the people involved when it came to selling it to him were like predatory, and they were taking advantage of him, as far as monetarily. But the truth of the matter is, it's like, I don't see any sort of like acknowledgement of personal autonomy when it comes to the fact that he engaged in this in such a way. And again, you just see this in our culture when there's someone with a substance use disorder. It's like, oh, they're just incapable of making decisions for themselves, and there's, we gotta blame everyone else and all this other stuff. And then it's interesting because on the other side, it's very like hyper focused on demonizing people with substance use disorders and blaming them. And so it's this weird
all part
mix
of the war on drugs.
Yeah.
And it all goes back to the messaging about drugs and the people who, and, and I think, there's a long history that we don't have to dive into there. One question before I get sidetracked is that I wanted to ask, describe what you mean by reintegration or integration therapy.
Yeah.
Like,
so,
what was your experience with that? What did that look like?
All right. So within like psychedelic communities, there's this concept of integration, and there's different levels to it. There's like, okay, so there's going to be like people who are like not clinicians that are like presenting themselves as coaches, and they are like, I'm an integration coach. And then there's going to be like people who are actual clinicians that specialize in basically holding space for people in a certain, I don't know, like the format of this, if it's universal or not. I'm really not quite sure. Based on the reading I've done, it seems like a lot of it just depends on the individual clinician. And then there are different ways that you can get trained on it, which I don't find to be valid necessarily. I don't, you know what I mean? Like it's interesting. It's because it's like an emerging thing when it comes to like psychedelic therapies. There's a lot of development that's been going on for some time now, but it's a very kind of Wild West scenario when it comes to like, what is integration, and it's dependent on like the provider. So I went with the direction of like my established clinician who, basically was asking me questions. So integration personally can be you just talking about the experience, writing. So for me, this is just my view of it, and this is kind of accepted, widely in a lot of different spaces. But it would be the setting of intentions is the first part. So you have to actually set intentions, and that can be done internally. I would encourage people to do that in writing. And then there's another part that often isn't talked about, and that would be like affirmation. So you set intention, you do affirmations. And actually, I developed my own like non-clinical kind of like workbook with this that you can utilize, and it just kind of makes it a little bit more structured to where if you're like, what do I do? You can actually go, okay, I'm going to write my intentions, and the intentions can be mental health, physical health, social, intellectual, spiritual. There's many different areas that you can go into, and so you acknowledge that, you write it down, you can create an affirmation for that, and then you check in with that. Probably, I didn't say repeatedly, prior to the infusion. I mean, there's different protocols that I've seen from even different clinics to where it's like you shouldn't go and like be overstimulated 24 hours prior, things like that. But again, in conclusion, it's basically integration is acknowledging the experience that you had, checking in with the intentions that you set, seeing if maybe any of that stuff was addressed, and just articulating the experience. And then there's the part of action after that, to where it's like, if you gain direct insight, then if there's action that can be tied to that, then you would take that action, and that helps you to embody this experience, thus integrating it into your life. So that's basically what I experienced with it. And just to give you one example, it had very much to do with my personal relationships and just the way that I engage. So it like changed that pretty significantly, while also like validating and strengthening dynamics that were already there, basically.
That's awesome. I mean, it's great to hear that you had a positive experience and that your reintegration helped sort of frame and solidify those thought processes and the positive sort of feedback almost that you got
Yeah.
from doing these infusions. And and we were talking a little bit earlier about sort of the history here and the ways that people have used ketamine, um, in terms of like isolation pods and and all that. I mean, I think the the history of ketamine. I mean, it's often discussed as a psychedelic.
Yeah.
From a medical standpoint, psychedelics really interact with serotonin. Uh, so one specific type of serotonin molecule in particular. Um, and ketamine is what's called an NMDA receptor antagonist. I won't go into all of that, but just to say that it's different than your typical psychedelic. And so it doesn't create the same sort of experience. It is a dissociative anesthetic, and not specifically a psychedelic. And you were describing, you didn't have the sort of auditory or the same kind of visual effect in that like a psychedelic might have. But people do use it sort of the concern is about its like psychedelic effect. Um, and so can you speak to that at all? Like when we
Yeah.
were talking about the history, that was something that you had sort of hit on.
Yeah. Yeah. So, I mean, I'm not going to go too deep into into I believe his name was John C. Lilly, if I'm not mistaken, and the creation of isolation tanks. But that's where a lot of this really kind of started when it came to looking into this from a psychedelic perspective. And this individual also was using LSD and going into these isolation tanks. And so, yeah, that's kind of the OG of that, honestly. And there, for me, so I do it when I did it. I did it with a blindfold on, so I would have closed eye visuals, and that's something that is way different than having open eye visuals. So
Right.
people need to understand that it's not like you're, in this stereotypical Alice in Wonderland scenario with your eyes open. That, I mean, I've not heard of anyone experiencing that. Maybe, I mean, who knows? But like, that's again this more kind of like stigmatized view of psychedelics, that you're seeing things that aren't there and stuff like that, which personally I've never experienced on psychedelics my entire life. Uh, my experience with it again was just closed eye visuals. So it was something that was very digital, very like a screensaver almost. So not I don't like that, honestly. That was the one thing I was like, this is what my brain creates, because this is not beautiful or pretty or anything. It's just weird. I was like, what is this? And it was very like purple, green, black, brown. Those are the colors. So
Okay.
those usually when you think about psychedelics, you're thinking about like tie-dye color, bright, very bright, vibrant colors. And no, it was nothing like that. And mind you, my eyes are closed, so it kind of makes sense when it comes to not having like
Right.
direct light in your eyes. But yeah, the psychedelic aspect as far as visual was just what people again call closed eye visuals. And then with my eyes open, it was distorted to where I was pulled back. I felt like I was pulled back a couple feet. So when I would look down, it was not like a bird's eye view, but it was pulled back to where my perspective was just very different. And the only auditory thing was that my hearing, when I spoke, I didn't hear myself talk until like a couple seconds later, which was really weird, and I didn't like that. I also could tell, because of that delay, just logically, I knew what someone was about to say before they said it, but I only knew the first, like, it wasn't like, oh, I know this whole sentence that's about to be said. It was like, there was each word that was said, I was like, I know what they're about to say. And again, just logically speaking, if there was a delay that I experienced, and that's why that was happening. But it felt very trippy and kind of again esoteric. The one thing that was esoteric and weird was that my friend came in during, and I had a blindfold on, and I knew that it was them, and I knew that they were about to talk, but they didn't. And so after, they're driving me, I'm staying at their house, and they're driving me home, and I go, "Did you come into the room and you like wanted to say something, but you decided not to?" And he was like, "Yeah." And I was like, "What, dude? Are you serious?" I was like, I knew it. Like, I knew. Did you like go like you were about to talk, but you didn't? And he was like, "Yeah." And I was like, dude. So that was the one like weird thing that happened, which again could be just complete coincidence or just I don't know. But
Or you just
that
became one with the universe.
I guess so. But look, it does make you very aware of outside stimuli, and that's why it's important to have a very controlled space after and to not be overstimulated and stuff like that. And so that was kind of the case to where I felt like I could feel people's energy, if you will, which again is just like a weird claim. But yeah, there was some of that. There was some of that weirdness that you do find with so-called traditional psychedelics. And because this is, primarily like an anesthetic, and so it's like technically what this would be like an atypical psychedelic experience, because it's not even
not a psychedelic.
It's not a psychedelic. So yeah, it had aspects of that. The second infusion was way more intense because I was going through grief. So that's another story. But it definitely helped with the depression that I was in.
I think that's really, all of that is really interesting here. And I wanted to talk about this specifically because I want people to be informed and to get some like realistic perspective on in terms of like the safety data. I think people should be reassured about that. That it's they're not going to die drowning in a hot
Yeah.
and again, advocating for it sounds like not just a controlled setting after, but like during the time that you're doing this, and
Yeah.
after you're doing this, and doing integration therapy, and having specific set intentions, and doing sort of the work afterwards to sort of solidify the effects.
Yeah.
But in that controlled, supervised environment, it sounds like it was very positive. And
Yeah.
it can, the data says that it can have benefits. There's an FDA-approved nasal spray for this. There are, clinics that have data about the benefits of this in terms of treatment-resistant depression. There is data on treatment of substance use disorders with ketamine. So I think it's important to talk about and give a realistic perspective and give some of the real data. And I'm glad that you had that experience to speak from so that we could give an honest assessment of it, and talk about that.
Yeah.
Sorry, go ahead.
No, you're good. Yeah. The thing is I think a lot of people will culturally look at these things as like a shortcut or a cop out, or you're just like trying to do something that's easier than like I don't know, maybe going into different modalities and stuff like that. And the truth of the matter is like, it brings up things that, can be challenging and can be hard. And again, I just have to reiterate that the reason I had an easier experience is because of the things that I already worked on for many, many years. And yeah, it's one of those things that people they should be aware that it's an option at least. And what I've seen it used for primarily is withdrawal management, which is it is not indicated for that. It's not used in that way. As often as I think it should be. But again, that's just based on what I've witnessed and seen, and also just before I forget, I want to say that in regards to people that are like doing a ketamine infusion and they're not setting their intentions and they're not, doing integration work, I fully support that too. Integration, if you're doing with the clinician, can be costly, and also at the same time, I understand people are going to do illicit ketamine, and it's tricky because we're talking about a illicit powder. And so, people just need to be aware that, like, if you're going to do this, which we're not advising at all, that there's a lot of testing that needs to be done when it comes to, reagent testing, fentanyl testing, xylazine testing, because,
being
you know,
supervised.
yes, and you
So
do not
make
want to
sure
do this alone.
you're
Like,
not using alone, especially if it's an illicit supply and from an unsafe supply, even if you've tested it.
yeah.
There
So
may be
there needs
things
to
that you
be,
can't test for. So make sure you have
yeah,
people around who are aware, who are able to supervise, no matter what. No matter what setting you're in, whether it's medical or not, make sure that you test it, take people with you. Make sure that you're safe. Obviously, that's the most important part. That's the thing we
yeah,
care the most about. But yes, knowing that, coming from a place of privilege where it is potentially accessible to do it in a medical setting and with integration therapy, with all of that, that is obviously the recommendation. That's and it's not for everyone, right? And so
yeah.
make sure that it's something that you've thought about, and that you do feel that that's going to be the right thing for you, and if you're able to pursue it in a medical setting. But for those who are not able to, or are not interested in that, please, please, please test what you have, use it in a supervised manner, in a safe way. We have people in
Yeah, and make sure that everyone's not using it at the same time too. That's the thing. It's like, it's not going to matter if you have people with you and you're all dosing at the same time. And even if you test it, make sure that there's someone around who has naloxone, even if you're not finding that illicit fentanyl is present. Again, just as a cautionary tale, because of different analogs and stuff like that, I just think that or as a cautionary measure rather, and I just think that just it's going to happen. People are going to continue to use illicit ketamine, and it's just one of those things to where I completely understand where that's coming from, and there's things that you can do just to put yourself in a less compromised position.
I think that's a good note to end on. Stay safe, everyone. Have a wonderful day. Thank you for tuning in. Please like, follow, subscribe, all the things, and we will catch you next time.
Views and opinions discussed on this podcast are personal and do not reflect the views or opinions of our employers. Although medical and clinical topics may be discussed in this podcast, the information provided is not medical nor clinical advice. Thank you for watching and or listening.